Good afternoon, everybody, or morning, depending on where you are. My name is Kelly Wellsell. I'm the CEO and owner of Beyond Indigo Pets. Today is July 8th. Welcome. It's a Wednesday. So Wednesday means telehealth. And you normally don't see Jess and I with our hair curled. Sometimes you see us with our hair back. And we actually both got online and went, what happened? So anyway, you get us dressed up day as well for Wednesday, right? Like we actually do clean up nice occasionally.
Occasionally, most of the time I'm just out in my garden and my hair's wadded up and I've got my glasses on and you wouldn't recognize me. This whole like working remotely and staying from home thing has really decreased my my maintenance, I guess.
Yeah.
But here we are.
Here we are, and there's even a whole section of clothing in my closet, and I'm like, yeah, I haven't seen or worn that for a gazillion years, right? Because you just
nowhere to go. I'm not complaining.
Not putting on dresses to work from home. It's just not happening, right? So what do you have today for us?
So today we have a little bit about alternative care models, I suppose. And these are going to be more and more prevalent, I think, as time goes on, because I think we're all sort of getting to this point where we're realizing that healthcare is pretty broken in a lot of ways, but veterinary care especially. You know, we've been delivering veterinary care the same way for more than 100 years. You know, someone sets up an office, someone brings pet to office, someone sits in exam room with pet, with doctor, and it's largely inefficient. And we know now that it also can expose us to, you know, everyone else's contagious diseases and all of that. And so as we're considering these new alternative care models and how to build telehealth into that, this is just a very interesting way to look at it. And so I found this news article today about a medical group, I believe it's on the East Coast, New Jersey maybe, called Reliance. And when COVID hit them, they saw a 60% decrease in revenue in patients coming in, which is pretty typical from what I've been hearing for veterinary clinics as well, that right off the bat just decreased significantly. And there was a lot of struggle for cash flow and revenue. And so this group had actually created a pandemic plan before the pandemic. So 5 million points to them because they'd actually thought this through and were actually prepared for the situation when it came up. But what they did was they created a virtual office. And so all of their patients that had these sort of chronic care issues or issues that they thought could be managed well through telehealth, they basically gave them a goodie bag that depended upon their condition. And so if it was somebody who had really high blood pressure, they sent them home with a blood pressure monitor. You can buy them on Amazon for, you know, $30. Same with a pulse oximeter. You can buy them on Amazon or at Walgreens for $20. And so for them, it was worth it to spend a little bit more and say, hey, here's a little baggie that has a blood pressure monitor. We are going to have you download this app. And we're going to have a nurse talk to you once a week, and you're going to give us your blood pressure readings. And then if you need to talk to a doctor off of that, we'll arrange a telehealth visit. And they found, and they quoted in this article, that they saw an exponential increase in revenue because of this. And so they were doing a lot of this through Medicare, which obviously does not apply to the veterinary field, but there's a lot of different ways that we can make this same model apply. But I think the real point of this article is that so many veterinarians seem to believe that switching to telehealth means that there's going to be a decrease in revenue or a decrease in how often they see their patients or how often there's visits. But that has been proven over and over again to be false if you're just willing to change your model a little bit and also push your clients to download that app or to get that wearable device. And so, you know, for this company in particular, they saw more patients grow, they saw more staff wanting to work for them, and then they also saw more clinics that wanted to join their group. And so rather than this just becoming sort of a status quo, let's get through the pandemic, This has now become an entirely new business model for them because it is so much more efficient than their old one. They're making a lot more money than in the old one, and their patients are getting better care than in the old one. They said that they've seen a significant decrease in emergency room visits because the patients are checking in more and they're uploading their data from home. And so they're, having better health outcomes because they are catching problems earlier. So this applies so strongly to vet med and the things that we can do with just a little bit of education. And so if we switch to the tip of the day, I'm going to sort of extrapolate on this of how can we switch care from episodic care to chronic care. And so that is our telehealth tip of the day is look at your practice model and think about where you can change that model to be a little bit more future-centric and human-centric. Because while we know that veterinary medicine is all about the pet, really, it's all about the human. Because if we can't get that human engaged, if we can't teach that human how important getting that blood pressure measurement is, then the poor pet's off on their own, right? And so yes, we're here for the pet, but we have to focus all of our energy on the human that is at the end of that pet's leash. And so chronic care is a really, really great way to sort of slip into this more easily. So chronic care being a use case for changing your practice model from let's just see this pet 1.6 times a year because that's the average to how can we have these people in our office maybe 4 times a year, but have conversations with them once a week or once every 2 weeks. So say a dog comes in and it's a newly diagnosed diabetic. You know that dog is going to need at-home glucose curves. It's going to need regular blood panel checks. It's more at risk for things like cataracts, skin conditions, just pick them. And so setting up something that's like, hey, we're going to introduce a diabetes care package. Here's a blood glucometer that, by the way, you can get at Walmart or Walgreens for $20. Teach them how to use it. Have your nurse check in with them via a telehealth app once a week, getting those glucose curves, just generally checking in, maybe having them shine a light in that dog's eyes to see if those cataracts have formed up yet. All of that can be done without a doctor involved. It can be done truly, fully through a good nurse who can then look at that and say, hey, you know what, this is in range, or no, we're going to pull the doctor in on this. And so if you can sell it as a package, our diabetes package is $200 and it includes 6 months of monitoring. You have now set up that patient for incredibly better outcomes because you're going to be catching things so much earlier. Same with arthritis, same with urinary tract disease in cats. We could talk about this forever, but there's so many things that you could send home with a client. So those wearable collars, there are clinics that are now buying up 10 of them and they're sending them home as part of an arthritis package. And then remote monitoring and having nurses check in once a week to look at that data and go, hey, we gave Rimadyl on Monday and on Tuesday, look how much more his activity increased. But we forgot to give it on Wednesday, and Thursday was kind of a bad day. And so the owner can now have more accountability because they're seeing those changes themselves. And when you've got someone from the clinic checking in on them, it really lends to that accountability factor and making sure that pet parent is staying more engaged. So just overall, you could even start this from a puppy, right? From a very first wellness visit, and then create a sort of continuous care package with behavioral consults or nutrition consults. And so just in general, shift your mind from we need to see a patient in the clinic 1 point whatever times a year to how many times can I have a touch point with this patient? How many times can I improve my relationship? Can I build more trust? Can I make sure this patient's healthcare is improving? And based on the human models especially, you will see tons of dividends with just a little bit extra work of really pushing a continuous care cycle with telehealth for your patients. So that's our tip of the day. Think about your practice models. There's some interesting ones out there right now. Someone in Madison is now doing a drive-through veterinary clinic. So there's some really cool different ways to practice now that the pandemic has sort of helped push to the forefront.
No, it's making us all change, right? And sometimes out of crisis comes creativity.
Absolutely.
Some people really take the opportunity to innovate because they do that. And we're now starting to see some of the innovations come out now that the crisis part management is kind of behind us a little bit, So, and I think, your article about healthcare, and I was thinking about compliance. Well, it's sure easier to be compliant about sending data from home and getting in a car and going and delivering the data, right? But just the ease of use there is just better. So, I was just thinking, well, for my dog, what would that mean? So I don't know, that's pretty cool, right?
Yeah. And, I think about, I had a patient that I adored who was an epileptic, and his owners would bring me a seizure journal every couple of months with, here's when they're happening, here's how frequent. And I remember looking back through that journal and going, geez, if I had seen this 3 weeks ago, I would have maybe altered a medication. Versus if they were able to send me that, there's actually some apps now that are dog seizure tracking apps that you can just forward that information to your vet. I would have been able to treat that dog weeks and weeks prior. So it's really going to change a lot of things for us. It's great.
Yeah, we're kind of getting to the Star Trek level.
I love it.
Now until we can just wave a wand, and then I'll be really super excited about that part, right? Like that part sounds really cool.
We might be a little ways off from that one, but
business. But I kind of like the concept, right?
Absolutely.
But hey, this is a first step. I think everybody during this time is realizing maybe how much extra steps we put in that took time. We don't have to go in the office, some of us, all the time. They're doing a drive-by vet. It's like we're monitoring to pets' chronic care cases, and people don't have to come in as often. I mean, it's changing the paradigm of society and what we view of how things should be done, right? And so some of it we like and some of it we don't like, but, there's innovation coming out of all of it. So it's pretty cool.
Yeah. Absolutely. And all of these new innovations and time savers then give us more time to do the things we love.
Right. Well, speaking of which, I have to show you today. So that is a definium.
Wow.
And
how tall is that?
Huh?
How tall is it?
It is 6 feet, 7 feet, 6 feet tall. So I think it's a grand definium. It's staked, or it would be lying on the ground. The actual purple part is about 2 feet long. It's one of my favorite flowers. I used to have 6 of them, and of course it tanked. But it just bloomed. Isn't that fun?
That's gorgeous.
Yeah, and so it's really, really fun, and I'm glad it didn't get taken out into some sort of storm. So, yeah, what do you think?
It's beautiful. It makes me worry about my foxgloves. They're about 5 feet tall, and I have not yet staked them, and I probably should.
You probably should, because one good wind and it's a downer, So, so it's really fun. I just thought I'd show it to you, but you can see it in context blown up, but once it's done flowering, we're done. Like that's it. We're over for another year, but it starts growing as soon as the frost lifts. So there's a lot of growth there.
Wow, that's cool. I might have to find one of those and plant it in my own garden. I'm starting to get pretty nerdy about all my different plant types. So
it's a perennial. So once it's in, yeah.
Beautiful.
No, so that's it. So that's my little show.
I love it. Well, I'm probably going to be going out and doing some weeding and working in my own garden after this too. So
well, enjoy.
I will. Yeah, see you all next Wednesday.
Okay. Bye.